Hi, my name is Zach Williams, and today we're going to be assessing cerebellar function. So there's 9 functional tests to be testing the examination for cerebellar function, but first of all we're going to go through the role of the cerebellum. The cerebellum is used for highly skilled movements. It is also used for the regulation of movements associated with posture and equilibrium. It is also associated with distal limb movements, proximal muscle regulation and eye movements in response to vestibular inputs. So for the 9 tests we have for the cerebellum, we have the testing of gait, assessment of the upper limb, assessment of the lower limb, we have assessment of the trunk, we also have speech assessment, assessment of nystagmus, hypertonia, pendular reflexes, and also checking for tremor. We'll start off for when we're going to be testing the gait. So when we're testing the gait, we are always looking for the pace, the size of the steps. We're also going to be looking for the posture, the swinging of the arms. We're also going to be looking for a widespread stance, uncoordinated legs, high stepping, waddling, apraxia, and antalgia. So there is a typical cerebellar gait, and that is comprised of a broad stance and also a wide staggering quality, antalgic towards the side of the lesion also. So towards the side they'll be leaning over. We also have the assessment of the upper limb as a second test. So in the assessment of the upper limb, we're going to be broken down into 2 tests. That's going to be the finger to nose test, and also we're going to be doing the repeated movement test. So the finger to nose test is where the patient has their finger placed on their nose and goes to try and touch the practitioner's finger. So it's just performed like so, going from one to another. The practitioner can move their hand up and down to make the test more complicated. When performing this test, we're looking for any signs of pass pointing, and we're also looking for any sort of types of uncoordination. With the repeated movement test, we're checking for dysrhythmia. So the patient just has their hand like so, hand on the bottom, hand on top, and the repeated movement of flipping over, back and forth. You just pick up the pace of that. With this, it is a test to see if they have quite a complicated name of a syndrome. It is called dysdiadochokinesia. We also have the assessment of the lower limb. With the lower limb, we have again 2 tests comprised in that. We have the heel to shin test, and we also have the tapping test. The heel to shin test, I will just demonstrate as shown. So the patient will be lying supine on the table. They will get their shin, they'll get their other foot, and they'll run the heel of their foot directly down the front of their shin. Whilst doing this, we're checking to make sure they can run a single line down the front of their leg. During the assessment of this, it is testing for the loss of motor strength, proprioception, and also for a cerebellar lesion. We'll also have the tapping test, and this also tests motor function. With the tapping test, the patient just has to be able to tap their feet on the ground like so. Okay, so now we're going to assess the trunk. On assessment of the trunk, we're assessing from a supine to a lying position, and we're going to be looking to see if they favour one side or they lean to one side, to give an indication of truncal ataxia. So, just with the patient lying down, you just get them to slowly sit up, measuring their hands on their knees, like so. Okay, beautiful. Now we're going to be doing a speech assessment. When conducting a speech assessment for cerebellar disorders, we get them to repeat many consonants within the same sentence. So we have an example that we used before, and it is the sentence of the British Constitution. If there is any sort of slurring or skipping of the consonants, it is a sign of a cerebellar disorder. With this, it is showing the scanning of speech, which is a sign of that. We then go on to checking for nystagmus. With nystagmus, we get the patient to follow the finger to each side of the vision fields. With scanning of either side of the vision fields, if there is a cerebellar disorder, on the side of lesion, we'll start to notice nystagmus at the lateralmost side. We also test hypertonia and pendular reflexes. We test hypertonia and pendular reflexes together as they work in unison. We'll use our reflex hammer, and we'll be able to show the patient just doing a normal reflex of the knee. If it is a positive sign for a cerebellar disorder, we'll see pendular reflexes, and that is where the patient will rock backwards and forwards after the reflex test is performed, also showing hypertonia. We also will be checking for tremors. A tremor is an involuntary incoordination and shaking of hands. So this will be seen throughout the appointment with the patient, and also when we test it also, you'll see a shaking of their hands, and when they try and do movements as such, they'll be a bit uncoordinated. That is how you check for any cerebellar disorders. Thank you.